Skin cancer is the most common type of cancer in the United States. It's generally a local growth, something that originates in the skin. The most common risk factor for skin cancer is ultraviolet light. It's something for which there are many treatment options, including surgery, radiation, topical treatments, and sometimes even systemic therapies. Skin cancer is the focus of my practice. Skin cancer is not contagious, no. It's something that comes from risk factors, including light skin, light eyes, too much sun exposure, particularly as a child, and oftentimes runs in families. So skin cancer is the most common type of cancer in the United States. Generally, we divide it up into two different types, the melanoma type of skin cancer and non-melanoma types of skin cancer. Non-melanoma skin cancers are things like basal cell and squamous cell skin cancers. Generally speaking, the non-melanoma skin cancers are local issues. They arise in the skin. They tend to stay confined mostly to the skin. And melanoma skin cancers are the ones that can be more serious and have a predilection for spreading if they're not caught early. There's a pretty broad range in terms of when we see skin cancers. We see it in patients in their sort of middle ages, 40s, 50s, 60s, and up, but we have seen cases of skin cancer earlier. For the most part, though, it's something that we see more in folks in their middle age. It seems to be preventable. Preventing exposure to ultraviolet light, whether it's natural from sunlight or artificial from tanning beds, is the easiest way to at least decrease the incidence of skin cancer, if not to prevent it entirely, as well as regular use of sunscreens and generally avoiding the most intense periods of ultraviolet light. So generally the 10 to 2 times are the period of time where you really want to avoid being out in the sun if possible, or if not possible, certainly to make sure that you have sun protective clothing and sunscreen. So risk factors for non-melanoma skin cancers are light skin, light eyes, light hair, and that certainly seems to be something that runs in families, although the skin cancers themselves are not thought to be inherited. For melanoma type of skin cancer, there does seem to be a stronger genetic predisposition, and this tends to run in families, and so that's why if somebody has a family history of melanoma, there's someone that we want to watch a little bit more carefully for skin cancers themselves. Skin cancers, there's a pretty wide variety in terms of how they can appear in your skin. Moles that are changing in size, color, shape, certainly something that we would want to look at more carefully as a possible skin cancer, as well as new spots that bleed or crust or are changing. Those are other symptoms where we would want to examine a lesion more carefully to make sure that it's not a possible skin cancer. So there's a pretty wide variety in terms of presentations of skin cancers. For melanoma skin cancers, generally we look for new moles that are changing in size, shape, color. Even sometimes moles that are going away can be something that we look at more carefully. For the non-melanoma skin cancers, it's a little less specific. It can be something as simple as a pimple-like lesion or a dry patch that sticks around. In general, things that come up and don't seem to go away are possible presenting signs or presentations of skin cancers. Skin examination is extremely important. Studies show that 50% of melanomas are detected on self-skin examination. Well, I think when people hear a diagnosis of cancer of any kind, they tend to get pretty upset by that. And so, one of the first things that I'll tell people when I'm meeting them for the first time, if they've never had this sort of thing before, is to explain that while we call many skin cancers or carcinomas, they tend to behave in a relatively indolent or non-aggressive fashion. So whenever possible, I try to reassure people that the spot that they're treating is not something that we think is going to be dangerous whenever possible. If someone has a spot that is dangerous, obviously we tell them that as well. But most of the time with these skin cancers, as long as they're caught early, we're able to reassure them that this is not something that's going to be serious. It's just something that needs to be treated. So in general, as long as skin cancers, either melanoma type or non-melanoma type, are detected early, they're highly treatable with cure rates averaging in the upper 90 percentile. Unfortunately, when spots are left and detected later, that's when the cure rates are not quite as good and the outcomes are not quite as good. So that's why we always emphasize early detection and early treatment. So skin cancer is the most common type of cancer in the United States. There are 3 million non-melanoma skin cancers diagnosed annually in the United States and almost 200,000 melanoma skin cancers diagnosed annually. So there's a wide variety of available treatments for skin cancer, and depending on the type and the extent of the cancer, we'll recommend a different treatment to each patient. But different treatment options include surgical treatments like Mohs surgery, radiation treatments, sometimes even topical treatments, and rarely we even recommend systemic treatments like oral chemotherapies. Depending on the treatment, the cure rates vary, and the amount of time for a cure varies. Surgical treatments, the cure is instantaneous. Once you're treated, the skin cancer is removed and it's no longer something you have to worry about. With some of the topical treatments or the light treatments, it can take several weeks, but in general, it's a fairly short time until treatment is complete. So for surgical treatments, anytime you're doing a surgical procedure, there's always possible risks. Risks include bleeding, which we take care of. Infection is rare. There will be scar tissue. You can't take off anything without leaving a scar, but we try to give you the nicest and least noticeable scar possible. And then recurrence. So although surgical treatments have a very high cure rate, they're not 100%. There is a very low chance of recurrence of the skin cancer. What's more common, though, is that people would get another spot someplace else. So we usually have them follow up with their dermatologist for regular skin exams, especially once they've had skin cancer. As far as we know, there really aren't many natural remedies for treatment of skin cancer. There are some multivitamins, some B vitamins in particular, or B derivative vitamins, that have been shown to have some modest effect in prevention of skin cancer. And so we certainly encourage people to look into alternative treatments for prevention, but these are very early and it's unclear exactly how much of an impact they have. And in terms of treatments, they're not particularly effective. We really recommend traditional medical treatments. So, as I said, if early detection and early treatment generally lead to excellent results. Unfortunately, sometimes we see patients who are either afraid and don't want to have something treated or just ignore it, and the condition becomes more extensive. And the effects there can be really quite shocking. Extensive ulcerations of the skin, you can have nerve damage, you can have muscular involvement from skin cancers, so they can be quite disfiguring if they are left untreated. There are alternative treatments. There's a wide variety of treatments, including things like light treatments, radiation treatments, topical medications, but it really depends on the particular type of skin cancer, and that's why that decision really should be made in conjunction with the dermatologist, because not all treatments work for all types of skin cancer. Well, you certainly want to let your doctor know if there's any new spots that you're worried about. It's a team approach. lesions that we notice on a skin exam may be different from the ones that you've noticed on your own self-skin exam. And the best way to detect any spot is to consider both, the ones that you notice and the ones that we notice. You certainly want to point out any spots on your skin that you've noticed that are concerning to you. This is really a team approach in terms of detecting skin cancers. And as the dermatologist, we want to look at the things that we notice, but also the things that the spots on your skin that you've noticed as well, and evaluate all of those. And so anything that you've noticed that you're worried about is certainly valid and should be brought to the attention of your dermatologist during your skin check. In terms of what I recommend, I think it really depends on the location and the type of skin cancer that we're treating. You also have to consider the patient and their emotional state, their physical state, and what's going to give them the best outcome. So it's hard to recommend one particular treatment. It really depends on a number of factors, and that's what we usually determine at the consultation appointment. Windsor Dermatology is really an outstanding dermatology practice. We have a wide variety of treatments, both surgical and topical, light treatments, a light center for treatment of psoriasis, clinical trials that are going on. It's really cutting-edge care for dermatology patients. It's never too late in terms of treatment of spots. So the earlier we catch these things, the better, but there are always options for treatment. And also, it's never too late for prevention. So if you're someone who has gotten a lot of sun over the years and hasn't used sunscreen, whenever you start applying your sunscreen, you'll notice there'll be a decreased risk of developing skin cancers. So even if you haven't been good up until now, it's not too late to start. So in terms of prevention, for people that are at high risk of skin cancer, we certainly recommend self-skin examinations, as well as regular skin examinations with a dermatologist, avoidance of ultraviolet light exposure, shade-seeking behavior, sun protective clothing, sunscreen. Basically just examining your skin, looking for new moles, moles that have gotten bigger or changing or otherwise symptomatic in any way. The hardest area to examine is really the scalp, and so generally the best time to do that is when you're right after the shower while your hair is wet, and there you need someone else to take a look. So having a partner or a relative take a look and see if there's any concerning or any moles at all really in your scalp that you would then bring to the attention of your dermatologist during your skin check. So I think Windsor Dermatology really offers comprehensive treatment for skin cancer. We offer topical treatments, we offer light treatments, we have excisional treatments as well as Mohs surgical treatments, and so it's really one-stop shopping for treatment of skin cancers, and that's really nice for patients that they don't have to go to different practices to get the care that they need. So I think the advantage of Windsor Dermatology in terms of treatment of skin cancer is that we have a wide variety of options. So depending on what specific treatment is really best for you, we're able to offer that to our patients.